Joel Kahn, MD, K-A-H-N, Preventive Cardiologist. There are so many differences between the way Anthony and his team train in the Moses method and what I've experienced at many gyms, and I think generally what people are receiving. One is personal attention and one-on-one, and there's no substitute for that careful adjustment, careful observation, careful feedback. It's a great luxury, but it also leads to results much quicker and avoids injury, which is always key to me. If I'm working out, I don't want to get injured. Number two, it really is Anthony's deep method, the Moses method, his deep understanding of muscle physiology, cardiac physiology, respiratory physiology. He is the master of measuring using the core system, our oxygen consumption, and then retesting and retesting. And now that he's added, actually body fat analysis and body shape advanced testing, I mean, that's what we all want, but it's just not available. And the Moses method is, in one package. See your body at baseline. Not everybody wants to know what that's like. But, as often as is needed, retest, retest, retest. It's very motivational. It's very positive feedback to actually have precision and see the changes. See fat around the waistline, fat around the liver, fat in the liver start to disappear, which is very healthy, but actually know how to measure it. So it's radical, but it is the way training ought to be happening.
My name is Patterson and my occupation is Doctor, MD. What makes this program different for me is the mindfulness part. I mean, you get the meal plan, you get what you should eat and what you should not eat, how long you should work out, what parts of the body to work, but no one ever talked about how you felt about yourself and how you viewed life in regards to your health.
Tom Spring. I'm an exercise physiologist and a health and wellness industry consultant. There's a lot of training programs out there, and there's a lot of good trainers out there. But oftentimes what other trainers do is rely on standard types of programs. So they have a set number of exercises or types of exercises, and they try to apply it to a lot of different people. It's easy and it's repeatable. What the Moses method does is it really follows physiologic science, and it takes an individual who may have different metabolism, different physiology and different responses, ages, genders, body size, body types, and it applies the physiologic science of metabolism and exercise science to that individual. And they do that by testing them and watching them and monitoring them and looking at their resting metabolic rate, for example, which everybody's a little different. Their oxygen consumption during exercise, which again, everybody's a little different. And their body composition and body type, which everybody's a little bit different. So the Moses method takes all that information and makes a cohesive program for you, the individual, based on your data and your science. And so that really stands out to me as a physiologist and is really attractive because it doesn't take a universal method and applying it to lots of different people. It takes individualized science and data and applies it to you.
You treat the patient and not the test. And most oftentimes when you get lab work, blood work, everything has a reference range. And just because it's normal for the reference range, that may not be normal for that individual. So the Moses method targets what that individual actually needs, from mindfulness, from emotional standpoint, from the calories to the RMR, from the VO2 levels. We learned that first year medical school about hypertension. So, and how oxygenation is very important because health is a science. And so it's more to it than just going to the gym and running on a treadmill.
We have been learning through this pandemic, through this COVID experience, that the same diseases that I am challenged with in the clinic, we call them chronic diseases that are both shortening lifespan and robbing people of quality life. Type 2 diabetes, obesity, high blood pressure, heart disease, early memory loss and dementia. That these very diseases, which are linked to poor lifestyle choices and very often poor fitness, are also linked to exposure and more extreme response to getting the coronavirus and dealing with it poorly or even being at risk of dying. High blood pressure is a risk, obesity is a risk, type 2 diabetes is a risk, and heart disease is a risk. And we're learning that our deterioration in health across the United States is unfortunately a setup for a rather severe reaction to the coronavirus. the Moses method, by identifying, measuring, and making it obvious that we are not at our peak health or peak performance, but then giving us step by step to improve our fitness, our wellness, our total health. It really is a ability to resist, fight, and survive through this very difficult time. I mean, it's an awesome interaction between his knowledge, our current crisis, and a solution.
Exercise is extremely important for preventing all kinds of illness. Your immune system response is very, very important for virus prevention. If you have a cold, if you have the flu, whatever things we're dealing with, if your immune system is stronger and your body is stronger and healthier, then you're less likely to, number one, get the virus. But if you do, which is somewhat possible, certainly, then your ability to recover from that virus or that illness is that much better the healthier you are. And with COVID-19, we're seeing many people get it, but the people who end up in the hospital, who are ending up on ventilators and unfortunately having serious complications from the virus, are those that have poor metabolism. They're diabetic, they're overweight, they have heart disease, they have other things that cause their body not to respond as well and fight the virus as well as somebody who is healthier. And exercise and metabolic health and being able to fight off a disease like COVID-19 is extremely important. And the Moses method is essential in the sense that the healthier you are and the stronger your body is and the more you're focused on your own metabolism and improving your own immunity, the better off you're going to be to fighting something like COVID-19 or any common illness that we have, including things like diabetes and so forth.
I hear this a lot. Well, you're a doctor, you can afford it, or you're a doctor, you should do this. Well, this is a place that treats doctors. So you should want to be a part of that, number one. Number two, you should never go cheap on your health. Most oftentimes I tell people you're spending money on things that you shouldn't be spending it on anyway. Fast food, from junk food, things that you should not have. Most oftentimes you need to redirect your dollars into better places, and this is the best place to be, especially if you get in the individualized methods and plans that you need to be healthy. It's not about the pounds, it's about the health and the inward health that is the most. So if someone is listening to me and you're just like, I don't know what to do, I've tried everything, you definitely need to try the Moses method.
I've been doing this about 25 years, and as an industry professional and a fitness professional for that time, I've seen many different programs. I've been in the certification business for trainers through the American College of Sports Medicine and other organizations that certify personal trainers. And so when the Moses method was introduced to me, I immediately found it to be very, very well rooted in science and at a level that probably many trainers would need to study hard in order to achieve the rigor of what the Moses method is trying to accomplish. But that's what we need. That's what the industry needs. That's what fitness professionals need to think about when they are trying to elevate their game and when they're trying to help more people in a very specific and personal way.
Well, the Moses method is revolutionary.
In my opinion, the Moses method is revolutionary.
The Moses method, in one word, is all about precision. You do not build a car where the parts sort of fit and put it all together and take it off the lot. You want everything to be milled and measured and accurate. But in medicine, we often don't practice that way, and in fitness training, we often don't practice that way. Precision, precision, precision. And the beauty of the Moses method is the precision about your parameters is different than my parameters, the patients I referred. But as long as we can measure accurately, then we can change the situation, retest, and see the progress. So precision fitness is what the Moses method means to me.